Blog Talk Radio. Welcome to Business Women Connect Radio, and thank you for joining us today. We have a great conversation today planned with Dr. Greg Chernoff, who is a triple board-certified aesthetic facial plastic and reconstructive surgeon. And if you've been listening along, I usually begin the show by saying, and let me take just a second and let you know that today's show is brought to you by Chernoff Plastic Surgery and Laser Centers, and check them out at drchernoff.com. That's drchernoff.com, with locations in California and Indiana. And today, we actually get to speak with Dr. Chernoff. So this is a wonderful treat. This is a surgeon who is world-renowned. He is sought after for his advice and his expertise, and he is going to share some of the latest and greatest with us today. So, Dr. Chernoff, thank you for joining us.
Thank you for your kind words. It's a pleasure to join you.
Great. Well, one of the first things that I just want to get straight into is, people do come to you for your wisdom and your knowledge base and your advancements, and you are at the top of the game for advancements in cosmetic surgery for surgical and non-surgical treatments. So could you just go over what some of those, it's a big question, I know, but what are some of the major advancements?
I think some of the misconceptions that arise out of just the term cosmetic surgery. People come to see us for various reasons, but the majority of patients, women and men alike, that come to see us really come in because all of us have features that we wish we could improve upon if we could. And for many of us, those features can have a negative impact on our self-esteem. And that's really what we do on a daily basis, is to help patients with their self-esteem. It's my job to listen to you as it relates to what may be troublesome to you, and then to offer you options and solutions and choices. And I think that's really what is so tremendous for patients in 2012, is that there are so many options, so many choices, both non-surgical and surgical. And when patients come to see us for a consultation, I'm happy to see them as many times as they like, spend as much time with them as they like. They're really coming to gather information, and as I said, we really appreciate taking an informational position for our patients, never one of trying to sell them anything. Usually when patients come and see us, we ask them when they look in the mirror, what would they change if they could, and that can really then be broken down into facial issues and body issues. And for both, there really now exist many treatments, both non-surgical, things that patients can be doing at home every day, things that patients can come in and do in the office monthly, that will help them have a gradual improvement in many of the features that are troublesome to them. There are also some new treatments that we can talk about today that are, from a scientific standpoint, probably the hottest treatment that you'll hear a lot about is called Lviv. This is the first FDA-approved form of your own cellular therapy. This is a therapy by which we can take a series of tiny little biopsies from behind your ears, send these to a lab in Pennsylvania, and for the rest of your life then they can tissue culture or grow your own cells called fibroblasts that make your own collagen for reinjection. So this is currently FDA approved for improving moderate to severe marionette lines or nasolabial fold smile lines. There are ongoing studies and have been past studies looking at other ancillary uses of your own fibroblast cells for the treatment of scars, acne scars, lip lines, and many other areas. So you'll hear so much about tissue culturing, about stem cell therapy. This is really a very hot area of aesthetic medicine. There are also many new non-invasive laser treatments for improving the tone and the quality of skin. For women, the most common side effect of hormonal changes, whether it's being pregnant, perimenopausal, being on the pill, is pigment variation on the skin. And we have some really exciting new treatments that can help blend pigment to the point where a patient really has to wear little or no foundation to cover their unwanted pigment.
I think a lot of women just said amen to that, so go on.
Well, they do. It's and that is every day. I probably meet a half dozen women that come in with the complaint of pigment variation and unwanted pigment spots, both facially and from a body standpoint. And so there are some new topical treatments, some new bleaching creams that are much more patient-friendly, and that they're not as drying as we used to see in the past. Many of the bleaching agents, patients would wake up and be quite dry, quite red in the morning. The majority of the ones that we recommend now are much more patient-friendly to utilize. There's a brand new laser therapy that is referred to as the DOT laser therapy. This is a form of laser therapy known as fractionated treatment, in that when we put our foot on the foot pedal, it gives off a series of little penetration points into the skin that penetrate down to where the unwanted pigment lives, but also you can deliver energy to your own cells that are in control of the tone of your skin. So these treatments are really like taking your skin to the gym from a tone improvement standpoint.
Wow. Very interesting. Very interesting. Now, and one thing that's occurring to me, and it really ties into how you started off when you were speaking, is that when you're listening to somebody, of course you're talking about, on a surface level, no pun intended, the things that they would like to change about their appearance. But I am assuming that you could almost doubly charge as a psychologist out of all of the things that you listen to and what people are really, really, really feeling on the inside. And what they feel on the inside is how they'd like to feel on the outside. So do you ever... Yeah, well, yeah, go ahead. What are you thinking there?
During the consultation process, it is so crucial when I'm listening to patients to ensure that patients are coming to us for the right reasons. It's well known. I donate my surgery to battered wives and victims of violence, and this is really far too prevalent in our society. And every week I meet women who come in and think that getting a little something done will cure infidelity. But we know that that's not true.
No.
Every week I meet women who think that getting a little something done will make their supposed loved one quit abusing them. We know that that isn't true. And so we really make sure that patients are coming to see us for the right reason. And the right reason is wanting to look your best for yourself, not wanting to do this for anyone else. Cosmetic surgery won't get you a better job. It won't get you a better partner. It will help you feel your best, and by feeling your best, that really enables you to present your best self forward, whether it is at home with a loved one, whether it's in the professional workplace. And there's really no one that can't admit to the fact that looking our best and presenting ourselves in the best light really does play a role in our success, no matter what we do. Once we determine, having said that, another word, that there's really no such thing as that word vanity. There isn't one of us that didn't spend some time in front of the mirror this morning in the effort to look our best. And as I mentioned earlier, all of us have features that we wish we could improve upon. And for some people, those features have a very negative impact on their self-esteem. And I'm always very pleasantly surprised how sometimes some of the smallest changes that we can help a patient achieve have some of the largest impacts on self-esteem for the improvement. I just had this conversation with two patients this morning. Sadly enough, we still live in a very chauvinistic environment, and I met two patients this morning who, through the course of their consultation, they were both excellent candidates for minimally invasive procedures, but both of them said, I need to go home and see if this is okay with my husband. And I